So myopia is something that we've had around forever and ever, and most people think of it as not being able to see at distance. It usually starts when we're young, although it can happen anytime in life. If it does start when we're young, it tends to be progressive. And progressive myopia or progressive nearsightedness has become a major topic because it is becoming an endemic worldwide. We're seeing more of it, and we're seeing it start much sooner in younger people. As it progresses, it can cause a lot of eye health conditions and things that can be very problematic. Many people ask what causes myopia or nearsightedness, and the answer is we don't fully understand. We know there are lots of variables that come into play. There is a genetic component to it, especially for high myopia. So when it gets to be really high in families, it tends to kind of run in families. We think that there's more nearsightedness now because our world has become we're not hunters and gatherers anymore. We're doing more and more up close work. And if you aren't getting outside time when you're growing up, that actually increases your risk of nearsightedness. So the easiest way to know that there's nearsightedness issues going on is if you see your child squinting or having difficulty seeing at distance, they need to for sure get in. When we go to treat myopia, depending on what your prescription is, depending on if it's progressive, those things will help dictate what the best option for the patient would be. So an option might be glasses, an option might be to put them into contact lenses. And when you talk about contacts, there are a number of options there. Are we trying to curb or slow down the progression of the nearsightedness? That is a different set of contact lenses. We have contacts that you can wear daily and throw away at the end of the day, which for kids, teens, for everybody really, it's super convenient, super healthy, but it isn't going to slow down the progression of nearsightedness. So when you talk about slowing down the progression, then that's when we start thinking about specialty contact lenses, a brand new FDA-approved soft contact lenses for kids that are specifically focused on trying to slow down that nearsighted progression, which is very exciting. We have medication, eye drops that we can sometimes prescribe to slow down that nearsighted progression. We've had some very good early success with that. I think the best thing to do for a parent or for a child or anybody that has nearsightedness is make sure that they understand what it is. Many times when, especially kids are getting more nearsighted every time they come in, they start to kind of really worry about, and rightfully so, am I going to go blind? And so there's a lot of explanation and reassuring that that's not going to happen, but there are some things we need to make sure that you are aware of, making sure that you're getting looked at frequently, for sure annually, and then know about the treatments to not let them get so nearsighted. If you or a loved one has any concerns about myopia or progressive myopia, call the vision clinic for an appointment. Let's talk about the options. We want to help.